Today's video is all about making friends with your vacuum, forming a relationship with your vacuum. It is so important to never skip the vacuum therapy portion of your body sculpting. And I get asked all the time, I hate vacuum therapy. I hate vacuum therapy. Why do I have to do it? Well, today's video is explaining exactly why you have to do it and why it's so important. In my opinion, it's the single most important part of your body sculpting. So it's pretty obvious that I have my moon face back. Today's video comes at the perfect time. I'm going to be doing a manual lymph massage on myself. I'm going to show you how I do it. And then I'm going to show you how to correctly do vacuum therapy with your handle after you do a body sculpting treatment. So let's talk all about why it's so important to do vacuum therapy or lymph drainage massage. The reason I have my moon face back is because I'm taking high doses of prednisone. Prednisone causes unusual fat deposits to develop in your face. So that's why my cheeks are so big right now. That's why my jowls and my marionette lines are so large right now and so prominent, because my cheeks are huge. It's because of the prednisone. Living with an autoimmune disease, you never know when it's going to rear its ugly head. And it decided to rear its ugly head with a vengeance. So what does me being on prednisone have anything to do with body sculpting and body contouring? So just bear with me a minute. Prednisone increases the reabsorption of sodium in the kidneys. And when the body retains more sodium, it also retains more fluid, causing fluid retention. So that's what today's video is all about, is how to drain. When you're doing body sculpting and body contouring and you're breaking the fat cells actually drain into the interstitial fluid, and the interstitial fluid needs to get into the lymphatic system and then drain through the body. So because of the fluid retention that I'm going through right now because of the prednisone, I'm the perfect candidate for vacuum therapy and lymph drainage massage therapy. So that's what today's video is all about. So let me go through and explain why it's so important to do your drain after any body sculpting procedure. When you go through and break the fat cell immediately drains into the interstitial fluid. The interstitial fluid is the fluid that surrounds all of the cells. The function of the interstitial fluid is to provide nutrients to the cells as well as remove toxins. So that's what we're doing. We're creating a waste when we break the fat cell when doing body sculpting. The interstitial fluid is constantly being drained and replenished from the bloodstream. So it's a cycle that it goes through. So when the interstitial fluid drains, it drains into the lymphatic system. So let's talk about the lymphatic system. The lymphatic system is part of our immune system. It helps protect us from infection and disease. It consists of vessels, nodes, and organs. But unlike the circulatory system, the lymph system doesn't have a pump. So sometimes it needs help to get a kickstart. So when you're doing your vacuum therapy or your massage therapy, you're going to be moving that interstitial fluid into what's called a lymph node. A lymph node is a small bean-shaped structure that acts as a filter that traps and destroys harmful substances like bacteria and viruses. So you're moving the fluid into the lymph node, which is the filter, and it's going to filter out any viruses or bacteria. Then the fluid is going to go into the lymph system. The lymph system is like a drainage network that keeps the body healthy by transporting immune cells, removing waste, and aiding in fat absorption. So that's what it's all about. It's all about removing the waste from the drained fat cells and getting it eliminated from our bodies. That's kind of a simple way to explain the lymph system and the interstitial fluid and why it's so important to get that fluid out of the body. Now I'm going to show you how I do a lymph drainage massage on myself to help with this fluid retention that I'm experiencing from the prednisone. You can do this lymph massage anytime. There's no limit to how many times you can do a lymph drainage massage. It's important to keep that fluid moving. When you're doing vacuum therapy or massage therapy, it's really important to get a really good slip when you're doing the process. You don't want the skin to be pulled tight. You want to be able to glide along the skin. When I do my manual lymph drainage massage every day, I use this anti-cellulite massage oil because it gives a really good slip. You can also, after you've done your body sculpting with your radio frequency and your cavitation, if you have a really good conductive medium that has a slip to it, you can actually use that as well. That way you can use your radio frequency while you're doing your vacuum therapy. This is the handle for the vacuum. And you can see that it has radio frequency combined. This is a dual handle, and it has radio frequency combined with the vacuum therapy. I won't be using the radio frequency. I'm only going to be using the vacuum therapy. I also want to point out that when you're doing these treatments, you can regulate the suction with the silver knob on the front of these machines. Every one of these body sculpting machines are going to have a silver knob somewhere on the machine. And a lot of times my at-home DIYers forget all about the silver knob. The silver knob controls the pressure in which the vacuum sucks. So if it's sucking too hard, it's because the silver knob is turned up too high. If it's not sucking hard enough, the silver knob is turned too low. So that's going to be your first go-to if your suction is not where you want it to be. The next thing I want to point out is a lot of times I don't even set the release on the machine. I want the full range of the suction when I'm doing my drainage. And I'll show you that when I do my vacuum therapy. If you don't have a vacuum on your machine, you can purchase a small handheld vacuum. This is just a palm-held vacuum cupping device that would work just fine for your lymph drainage massage if you don't have a vacuum on your machine. Something else that really helps drain the lymph system is a vibration plate. I stand on my vibration plate every day for 15 minutes. And I actually have a really nice vibration plate that has a lymph drainage setting. The other thing I really suggest is the Big 6. If you're not familiar with the Big 6, I will leave a link to it in the description box below. It's a quick massage that activates the Big 6 lymph nodes that are most commonly backed up or clogged. But like I said, I will leave a link to the video and the creator in the description box below. So typically I'm going to be in the privacy of my bathroom doing my lymph massage after I took my shower. I'm also doing it after I did the Big 6. So, and like I said, the Big 6 will have a link to the video in the description box below. So you're going to use your massage oil, and you're going to use a generous amount. And you always want to work from the top down, always working towards the heart from the bottom up. So I'm going to put it all over my arms. And then using my hand in a cupping motion, I'm going to start at my wrist and I'm going to move in a slow direction toward my armpit. And if I don't have enough oil, I'm going to add more oil. Move it toward the armpit. And you can see the fluid actually getting built up towards my armpit. Then I'm going to massage it to the armpit. And I'm going to do this 7 times. My skin is not being pulled at all. My hand is gliding across my skin. When I get here, I'm going to really massage this into my armpit. A lot of times women will have built up fluid here. You just want to push it into your armpit. And you can actually see the fluid being pushed. Same thing with the backs, the bra fat. You can actually see the fluid being pushed. So again, lots of oil so that you get a slip. So using both hands, I'm going to go in an upward motion and really work that fluid into the back of my knee. I want that fluid to get into that lymph node. And I'm going to do this 7 times. And you can really see the fluid move. Firm pressure, but not hard. Now I'm going to move to my thigh, and I'm going to push it all the way into my groin. So same thing, I'm going to cup my hands and really move that fluid. And you can see how it kind of bubbles, it kind of pools up right there at the top. And then I'm going to work it into that lymph node. And I'm going to do this 7 times. Okay, now abdomen. So you can see that I have a lot of fluid, especially here. You can really see it rippling. So I'm going to benefit from this massage. Lots of oil. So when you're doing your abdomen, you want to go from the back to the front. So you have your lymph nodes here and in your groin. So you want to make sure that you move all the fluid into the groin. So I'm going to start here with both hands, and I'm going to start at the base of my spine, and I'm going to move all of this forward and then down. And I'm going to do that 7 times in a slow, controlled motion. I'm going to move my hands up a little bit more, and I'm going to do the same thing. Slow and controlled towards my groin. 7 times. Now, above my belly button, I'm going to go towards my heart. And then I'm going to do a circular motion to finish it off. 7 times. So when I'm doing my vacuum therapy, it's going to be the same as I did my manual massage, only with my vacuum handle. I'm going to make sure I have plenty of massage oil on because I want that vacuum to slip. So you can see that the vacuum pressure is not to the point where it would be painful. You never want it to be painful or leave a bruise. You want it to be strong enough to be able to, you want it strong enough to suck the area up and move the fluid, but you don't want it to bypass the lymph system. So holding my vacuum in the palm of my hand, I'm going to start at my forearm and I'm going to work my way to my armpit. I'm going to do this for 5 minutes. A slow, controlled movement. Make sure that you have plenty of oil. You want your vacuum to slip. You don't want it to tug. You don't want it to pull on your skin. You want it to slip. Always moving towards your groin. Now I'm bringing all of that fluid into the front and into those lymph nodes. So I'm pushing it from my knee to the back of my thigh and then pulling it up to the front of my groin and depositing it into that lymph node. And you can see that the vacuum pressure is enough to pull on my skin, but not to leave a bruise. It's so important not to bypass the lymph system. And you can really see that fluid being moved. And you're going to do it for 7 to 10 minutes, but because of the video time, I'm only going to do it for 5. Lots of oil. So from the back to the front. And when you're doing your vacuum, you're going to place it flat against your skin in a firm pressure, but not hard, and then tilt it up. So you're going to kind of go like that and it'll release it. Slow and controlled, never fast. Working towards your navel and then the groin. From the belly button up. Really work that vacuum into the front of your lower tummy, down to your groin. And then you're going to finish off in a circular motion. So this is what it looks like after both vacuum therapy and manual massage. Some redness, but no welts and no bruising. So now I'm going to go stand on my vibration plate for 15 minutes and make sure I drink plenty of water to get all of this fluid that I moved into my lymph system out of my body. I hope this video was helpful in explaining how to do the vacuum therapy and manual massage after you do your body sculpting treatments. Or, like me, you have all this fluid retention because of some medication that you're taking. And as always, everything I use in my videos will have links in the description box below. If you enjoyed this video, please let me know. Like and subscribe and leave a comment down below.